Good morning. Welcome to our new Queen Bee interview series. Today is all about how to give up your corporate life and become a very daring entrepreneur. So today's guest, we have a very special guest, Dr. Jinah Yoo, who is a UK trained consultant dermatologist. And you can tell from Dr. Gina that she's a very beautiful Korean. And I have the honor to introduce Dr. Gina a bit later. So my name is Sally Mae Yip. I'm the co-founder of Chinese Mom in Business Club. And today we also have my amazing co-founder, Xiaofeng Sutton, who will also introduce herself shortly. So to briefly introduce Dr. Gina. So Dr. Jinah Yoo is an award-winning Korean and UK trained consultant dermatologist with over 20 years experience in the UK and South Korea. And I know that, and I've the big fortune and privilege to actually work with Dr. Gina when she just founded her new clinic in central London, so called Dr. Jinah Yoo Dermatology. And her mission is really to innovate and provide the newest, advanced, safest dermatology solutions to transform our approach to skin. And personally, I have the joy to experience the first-hand treatment from Dr. Gina. I have to say that's the world-class, the best, without any bias.
Is that why you look so refreshed and
Yes.
Beautiful today? And
yeah, I'm
all right. I'm sold.
Yes. So today we really want to learn more about Dr. Gina's own professional and personal stories and sharing with us.
Cool. Welcome, Dr. Gina. And so my name is Xiaofeng, and I co-founded the Chinese Mom Business Club with Sally. So it's absolutely my honor today to actually learn about your journey. And as Sally mentioned, you are a Korean and UK trained dermatologist, and also recently opened your clinic in central London in February this year. So many congratulations on starting up the entrepreneurial journey. So how is the journey so far of running your own business?
So first of all, thank you very much for inviting me to have a chat with you today to share my journey. So as you've already done the introduction, I'm a consultant dermatologist. So I went through 16 years of medical training from the university to become a consultant dermatologist. And my passion was always to be a dermatologist, which is very visual specialty, but quite often it's not very well done or properly understood. So and there is a lack of understanding in the Asian beauty and understanding the different concept of beauty or skin diseases more common in Asian. Mm-hmm. So I started planning to set up my own private practice about 8 months before opening. So it was summer last year when I actually signed the lease, but the lease wasn't due to start until December last year. So I had quite some time to start planning the business. So this was my first business. So I've been always working as a NHS doctor, where we don't get taught on how to run your own business. But so it's a very daunting process, and I wasn't quite sure where to start from the beginning. So there were lots of trial and errors. And getting lots of advice from my colleagues who has gone through the same path. And then also there was some consultants I involved later on to help with setting up the clinic. Mm. So initially, when I signed the lease in summer, I started looking at different laser devices, which is the biggest investment in my clinic. And it takes a couple of months for them to build. So it was a good timing to start looking. The main challenge was getting the CQC registration. So CQC stands for Care Quality Commission. So they are like police in healthcare sector.
Oh, wow.
So, yeah, so you need to actually see a medical patient, you need to get a CQC approval to allow you to start practicing your clinic. So if you look at a lot of aesthetic clinics, they are not always CQC registered. So they are not really regulated. whereas CQC registered clinic is more regulated with lots of policies and regulations to follow. And we get inspected every year to make sure that it's meeting all the requirements, and we are complying with the patient safety, etc. So it involved writing like 50 or more different policies. So from like an infection control policy, or like a waste disposal, Legionella. So very tedious thing, which is not directly linked to medical services. So it has taken me a lot of time to write all the policies. And then I didn't hear from them since submission for about 4 or 5 months. So
wow.
I was getting quite anxious by January that I wasn't hearing from them. So, but luckily at the end of January, I had an interview with them, and then it was all approved. So it was all in good timeline, luckily, because I took over the lease at the end of December last year, and then I had about a month to work with the renovation and etc. So, but the CQC registration was my main challenge, and waiting and this uncertainty of what's going to happen was the main challenge when I was setting up the clinic. But I realized soon that it's not all about your passion for innovative services. You need to look after, there are a lot of admin issues to think about, all the like electrical water suppliers you need to register. I had to get all the electronic devices checked for to be compliant with the medical use, like air conditioning inspection, fire testing, so many things which I've never done before. So, but I think I will do better next year because I now know that all the steps I need to go through every year, which I need for the CQC inspection. But and then another main challenge I initially had was the marketing, because I was mainly based in Birmingham, where my patient pool was based in Birmingham. But this was a new clinic, and there were a lot of existing clinics in surrounding areas in High Street already. So I was trying to find out what would be my patient group, because I can't target all the British population. So I need to select a patient who will be who will have the most benefit from my service. So that's how I found Sally, because I know that there is a big Chinese community and Asian community in London, and I want to focus on the Asian patients who I understand I have better connection and better understanding of their skin. So yeah, so that has been my journey so far. Yeah.
Certainly feel like the long coming journey in a way is you know, for very early on, you already know what you wanted to do, and then you got all that kind of 15 years experience in the bag, and now and to it definitely feel like is a natural next step to have your own clinic. So I think we all feel very lucky we have somebody who like you, and then again, like what you said, we are connected from the culture and then understand, so it's more easily connected. So I'm sure you have big ambition for your clinic, for your business.
Yeah. So I always like to have a aim in my life. So the next step, I think, will be to establish a reputation as a leading innovative dermatology clinic in London, who amongst the Asian community, and also those people who have interest in Asian beauty. Also, I've been involved in a lot of research and education role when I was working in the NHS hospital, and I'm also an honorary lecturer at the University of Manchester Skin Aging Master's degree course. So I'm working closely with some commercial companies or the laser companies to do some trials to actually, by doing the trials, that's how you advance the technology. So rather than just doing what other people do, I wanted to be more creative and innovative. So I'm working with the university to set up some trials to use laser in different ways to other doctors. So I like combination of education as well as seeing patients.
Fantastic.
Yeah.
Yes, that is really setting up the benchmark and it actually pioneering new technology in your area. That is really inspiring, not just surfacing in that sense. And thank you, Dr. Jinah. I have really the honor to work with you since you started your journey. And I can already see you have achieved so much in a few months, which is really inspiring to see. I wonder if there's any like top challenge you are facing at the moment that perhaps you can share with us, and maybe we can also share our experience with you since both of us are entrepreneurs.
Yeah, I think I briefly mentioned earlier, but like making people become more aware of our clinic, and then choosing the right patient group is the most challenging part, I think.
Yeah.
So by working with Sally, I think I've never heard of the Red Book until I met Sally. So it's understanding different cultures and overcoming the communication barrier between with the Chinese population in London. I think that can be helped by the PR agencies like Sally. I'm not just telling it because Sally is here, but I had such a good experience with her, and I am so grateful for what she has been done and what we are continuing to do. So I think working with people who understand your client group is very important. And also I'm working on the Google SEO as well, because nowadays many people, they just search online and then they find restaurants, doctors. So everything is through Google. So that's how I'm aiming to approach non-Asian population, because I can see all types of skin color, not just Asian. So I want to also approach other ethnic groups as well through Google.
Yes, I totally agree. I think for all businesses, finding the right clients who value your services and build a really strong relationship between yourself and the clients are absolutely vital to the success of your business.
Yeah.
And also, I think it's about your unique selling point, isn't it? We always say, what's your unique selling point? If you use one sentence about your clinic, about you, and you know what is it? And so I think that's basic from my experience. That's really our challenge, because like what you just said, your ambition is becoming the leading dermatologist in London. And as we're in Asian community, that could be a starting point. Sounds like a natural connection, because really for me, from my perspective, when I look at you, I have a connection with you. You are the face of your clinic. And so I think that's a really strong connection going there. And once you get that kind of authority within that community, and you can actually use that as a base to expanding into any other culture. So so it seems like, you know, you are in a safe hand and you're really doing the right thing. So I'm very, very pleased with that. And you have received obviously a lot of awards and recognitions over the years, and we all always have a proudest moment in our life or work. So what's your proudest moment?
So I think from my career point of view, I've done many other degrees, like 2 masters and then 1 PG diploma, etc. But last year I've been awarded something called FRCP. So when doctors become a specialist in certain specialty, then we've been awarded an MRCP. But FRCP stands for Fellow of Royal College of Physicians. So it's awarded to the, I would say, the top specialist in that specialty field who did a lot of contribution in the specialty. So whilst I was working in the NHS hospital, I specialized in hyperpigmentary disorders. So these are conditions which makes the skin go darker. There can be lots of causes, but I set up the first and only NHS clinic running seeing hyperpigmentation patients. And I've done a lot of research and publication presentations through it. But also I had another specialty in skin lymphoma. So that's a type of cancer, blood cancer, but starting in your skin. So I had two very different subspecialty interests, but I like a bit of excitement and diversity, which keeps me going. So that allowed me to do a lot of presentation research, and then I've been awarded this FRCP last year. So normally for a specialist, we get this award when we are over like 50s.
Oh, wow.
When we spend a lot of time contributing to the medicine, advances in medicine. But I think I was one of the younger doctors to be awarded this specialty early in my career. So yeah, I am very grateful for that.
Oh, that's fantastic. I mean, you are only 25, and that's definitely. But in my eye, you're 25, probably younger. I mean, for us, it definitely is a proud moment of your life.
Yes, and talking about work, now we've shift our focus to your mommy life. So I understand that you are a mother of two teenagers, around 10 and 12 years old, and now you're running your own business. Life is very busy. So how do you try to find balance between work and life? And are you a tiger mom or not?
It's our golden question, Dr. Jinah. It's our
Yes.
golden question we ask every single mom. Are you a tiger mother? How you balance?
Do you get yes for that question a lot, or?
We do, yeah.
Okay, so yeah, so I realize now how peaceful my life was as an NHS doctor compared to running my own business. So you never really have a break. So we had some like a long weekends recently, but I had to hold my phone answering any queries throughout the weekends. So you don't really get any break when you run your own business, especially at the beginning, at least.
Yes.
I mean, luckily my boys are currently at boarding schools during the weekdays. So that allows me to focus on my work during the weekdays. But I only open from Monday to Friday deliberately so that I can spend time with the boys at the weekends when they come home.
Yeah.
So they only come home maybe like for just over 24 hours. If they finish at 4 p.m. on Saturday on most weekends, and then they need to go back on Sunday evening. So I mean, I don't have enough time to be a tiger mom, I think. So I leave it up to the school and the boys to actually get on with their work, and I'd rather actually spend good quality time with them at the weekends and during half term or holidays. So I like to take them to a lot of concerts, which I'm interested in, galleries, going out for a nice dinner, etc. So and then of course playing football at Regent's Park. So yeah, so I wouldn't say I'm a tiger mom because I've gone through that step. So to be a doctor, you need to do lots of academic work, and it's continuous work you need to do even after becoming a doctor, because medicines always advances. New medicines come out, new lasers come out. So you need to attend conferences all the time and read journals. So I don't, unless you are very committed to that specialty, and if your child is really willing to go through that step,
yeah.
I wouldn't really push my children to go through the same path. So I leave it up to them. I want them to experience lots of different things so that they can develop their own interest rather than forcing them to focus on the work. So yeah.
Definitely,
It would
I
be
think that's
interesting to see what kind of person they will turn out later on, because my younger one wants to be a footballer, but unfortunately he's not talented. So but if there are plenty of jobs he can do around football. So I want them to actually develop career in what they're really interested in, what they love about. So
yeah, I think this is very very interesting, because this is what or often the kind of answer we get from Asian moms, because often we educated in a very strict Asian culture, but then we also massively influenced in Western culture. So often we actually been able to have that kind of mindset of both good side from Asian and Western to our children. We tend to not really like very academically kind of tiger mother, but we're more and more towards leaning to their own interests and also their own mental health. So I think it's perfect. So time flies. We reached the last question, and really, do you have any role model who you're looking up to, or any kind of attributes you actually admire from that person? And we would love to hear about that.
So I wish I can give you a very interesting story, but but my role model actually is my mom. So yeah, so she had her own career throughout her life as a headmistress. So she was very bright, and she likes working with children, very caring, hardworking, and humble. And she has very good interpersonal skills, so that she interacts with people in very nice way, and has developed long-term relationship with the employees. So so my mom is my role model for the career-wise, as well as as a mom as well. She has been very caring and loving. So she although I mean, when I was in Korea, I came to the UK when I was 13. So I would say she was a tiger mom when I was in Korea. So I've been forced to go to a lot of tuitions, etc. But since I'm in the UK, she wasn't able to do that remotely. So but she allowed me to do what I want to do. She has been always supportive, giving really good life advice. So yeah, so I think my role model will be my mom.
Sounds perfect. I love that.
Yes, great. Time flies. We finished our questions to Dr. Jinah. Personally, I have learned a lot from Dr. Jinah, being open-minded, keep trying, and also being strategic to find your right customers, working with the right partners, and also being a very nice mom to your boys as well. I don't know if Cell Phone has anything to add before we end our
Definitely.
session.
So I hopefully all the moms who are watching actually enjoying Dr. Jinah's story as much as I do. And for me, Dr. Jinah is just very personal. You know, it just really feel very easily connected, and somebody who I can actually turn to just basically have a conversation about all the problems that I experiencing with my skin, which is I had a quick chat briefly with you on our event in May. And so it's just very you seems very calm and naturally obviously beautiful, naturally attractive me to you. So I'm looking forward to actually have a chance to visit your clinic. So I hopefully everyone, when you actually in London, and then come to have a look, and then you might find out all the stuff you don't know about your skin, and then make you extra beautiful. So I think that's really the full purpose of Dr. Jinah, is here to make us beautiful and confident from outside and within as well. Cool. So thank you very much, Dr. Jinah, and I really enjoyed that.
Thank you. Thank you so much.
Thank you.
Bye.
Okay, bye.